Welcome back to another Score Builders question and answer video session. This video provides members of the Score Builders team with the opportunity to explore challenging multiple choice examination questions with students actively preparing for the licensing examination. My name is Scott Giles, and I will be your host for today's journey. I will read the question and provide you with an additional 60 seconds to answer the question. Ready? Let's go. A physical therapist prepares a patient status post-CVA with global aphasia for discharge from a rehabilitation hospital. The patient will be returning home with her husband and daughter. What is the most appropriate form of education to facilitate a safe discharge? Option 1. Perform hands-on training sessions with the patient and family members. Option 2. Videotape the patient performing transfers and activities of daily living. Option 3. Provide written instructions on all activities of daily living and functional tasks. Option 4. Meet with family members to discuss the patient's present status and abilities. In order to facilitate a safe discharge, it's imperative that the physical therapist is certain that the patient and family are aware of and can perform the necessary activities of daily living and functional tasks that will be required. Let's explore each of the options. Option 1. Perform hands-on training sessions with the patient and family members. Hands-on training sessions provide unique opportunities for the therapist to assess the competence of family members in a structured environment. This type of session enhances learning through active engagement, leading to improved skills, knowledge retention, and preparedness. Option 2. Videotape the patient performing transfers and activities of daily living. Videotaping the necessary transfers and ADLs will provide the family with a visual aid. However, it does not ensure that they're able to safely perform the task with the patient. Option 3. Provide written instructions on all activities of daily living and functional tasks. Providing written instructions on all ADLs and functional tasks is an important part of a home exercise program and should be included in all discharge plans. However, this action does not ensure that family members are able to perform the task safely with the patient. Option 4. Meet with family members to discuss the patient's present status and abilities. Meeting with the family members to discuss the patient's present status and abilities is an important part of any discharge planning. However, it will not provide the therapist with enough information on the family's competence with the required tasks. The correct answer is option 1. This is an experiential question where students have to consider 4 attractive options and select the best answer. It's critical that students evaluate the benefit of each option while focusing on the primary goal of the question, to facilitate a safe discharge. Safety at home for this patient will be most influenced by the caregivers being able to correctly perform their defined roles. As a result, hands-on training sessions will typically be the most beneficial. Let's explore the all-student data. 64% of students selected option 1, perform hands-on training sessions with the patient and family members, the correct response. 12% of students selected option 2, videotape the patient performing transfers and activities of daily living. 8% of students selected option 3, provide written instructions on all activities of daily living and functional tasks. 16% of students selected option 4, meet with family members to discuss the patient's present status and abilities. System classification. This question is a neuromuscular and nervous systems question which represents approximately 24% of all exam items. Content outline classification. This question is an interventions question, which represents approximately 29% of all exam items. Level classification. This question is a level 3 question, since the question requires candidates to systematically analyze and often interpret information to determine an appropriate course of action. The questions tend to have some degree of subjectivity, and candidates are required to assign varying degrees of importance to different variables. Academic focus area. Looking to review related academic content? Check out pages 825 through 828 in PT Exam the Complete Study Guide. Thanks for joining us on the Score Builder's question and answer video session. See you next week.